Good morning, I'm Daniele Manfredini from the University of Siena, Italy, and I'm here to introduce you a tutorial explaining a very interesting project we are performing on awake bruxism. Awake bruxism is emerging as a medical condition of interest for many medical professions, dentists, psychologists, neurologists, even sleep doctors. And we are getting deeper into the study of this condition by taking advantage of new brain technologies. The project I'm introducing is taking advantage of the cooperation of more than 20 universities all over the world, and more than 20 translations have been performed so far. The core base of the project is that we are going to use the EMA, the ecological momentary assessment, which is a very important principle to record data in real time. A very good friend of mine, wonderful people, super smart professional, Alessandro Bracci of the University of Padova, some years ago ideated an application to be used for smartphones, and this application takes advantage of a very simple strategy. Basically, it sends alerts to the patient and asks them to record and to report the condition of their mouth and their jaw muscles in real time. So, with this tutorial, we are going to introduce and to describe the 5 possible conditions that are to be reported in real time. The first condition is the relaxed jaw muscles. Then there are the possible phenomena that are part of the awake bruxism spectrum, and namely teeth contact, teeth clenching, teeth grinding, and a condition named mandible bracing, which is the situation in which you are keeping your teeth apart even when you are the muscles contracted, braced. The first condition is, of course, the physiological one. So, for you researchers and for you patient, how to instruct the patient, or as patients, how to recognize the condition of relaxation. Basically, in physiological position, we have to keep the mandibles apart with a 1 to 4 millimeter interarch space and the jaw muscles relaxed. This is the relaxed jaw muscles condition when you receive the alert from the application. Every time you are performing some other activities, you are basically entering what I call the awake bruxism arena, which is the condition, for instance, the very simple presence of teeth contact. Are you teaching the teeth of the mandible with the teeth of the maxilla without performing too much strength? That's the condition in which you have to report teeth contact. If you are contacting your teeth, but you are performing a very strong muscular activity, like the condition in which you are clenching, not necessarily with maximum force, but with a condition that is more strong, that the condition that is required to keep the teeth slightly touching, you have to report a teeth clenching situation. Of course, teeth clenching may be in a so-called centric position, which is the maximum intercuspidation, or even with the mandible in a not necessarily centric position. From prosthodontic perspectives, that could be called eccentric position. Rarely, maybe you are grinding your teeth, as sometimes happens during the night. Of course, this is more a condition related with tics or myoclonus, but anyway, every time you are moving your mandible forward and backward or laterally grinding the teeth against each other, that's a condition you have to refer to as teeth grinding. And then the final condition, every time you are exerting some sort of muscle force, but you are not keeping your teeth in contact, that's a condition that we call mandible bracing, which is basically the equivalent of clenching, but without keeping the teeth contact. This could be a very strange situation for you to realize and to perform naturally, but for our experience, when you receive the alert, it may happen in a much more higher percentage than you believe, that you are engaging an activity that requires the contraction of your masticatory muscles without any teeth contact. Basically, you have your lips tightened or your mandible pushed forward, or you are doing something that requires the engagement of muscle force that is not necessarily needed. So, thanks again to Alessandro Bracci. This is our project. This is our very brief video tutorial to explain researchers and patients how to report the data for any studies or any clinical application. We are waiting for your cooperation, and of course for any needs, that's the email address to refer to. Thank you. Bye bye.